We're pleased to welcome Carol Ann Giardelli, Director of Safe Kids, New Jersey, also Central Jersey Family Consortium, Health Consortium. Good to see you.
Thank you.
You were on with us a while back.
Yes,
We're talking about trying to keep our kids safe.
Absolutely.
Tell everyone what your organization does.
Well, Safe Kids is actually a worldwide nonprofit dedicated to preventing injuries to children. It's the #1 way that kids die in this country and in the world is through injuries, and 90% of them could be prevented.
What can be prevented? By the way, we're making sure your website is up so people can find out more. Go ahead.
Great. What could be prevented are the leading killers of kids, and they basically fall into several categories: falls, traffic crashes, poisoning, drowning, and fires and burns. Those are the leading ways that children get hurt.
Let's be more specific about prevention. What are some of the, I don't want to say easier, because nothing's easy, the smartest things for parents to do?
Well, there's some tangible solutions that are ready for all of us, hopefully, such as simple things like walking around your entire car before you back out of the driveway. Little things that we try to make people aware of. Obviously wearing safety belts, using car seats, bike helmets. For some people, those solutions may not be tangible. They may not be readily available to them. There are intangible solutions such as active supervision, making sure that you set the example for your child and practicing safety rules within your home.
So interesting. I don't like to disclose this, but I will. I was riding bikes with our daughter the other day, and I made sure she had her helmet on.
Did you have yours on?
No.
Yeah.
And I shouldn't say that, but I'm going to be honest about this, and
absolutely.
she called me on it.
Good for her.
We had to go back,
Yeah.
had to put the helmet on, but it should never have happened.
Well,
I should have set a better example.
And you know, hindsight is 20/20, so thank goodness nothing happened on that trip, but now
lucky.
you'll be more aware, absolutely.
But again, is it true, not just when it comes to safety for our children or trying to keep our kids safe, that it's less what we say, more what we do?
The children are looking towards us to set the example. So if we tell them, you have to wear your helmet, but mommy or daddy doesn't, it really is not setting
And it's not to say, well, you're a kid, I'm not. That's a ridiculous explanation or response.
And it doesn't mean that an adult couldn't get a brain injury as well as a child.
And they do. Let's follow up on this. How many children, I hate to ask it this way, but die every year from these injuries?
Well, in the United States, it's about 8,000 that die. We're not talking about the millions that are going to emergency rooms as well. So about 8,000 kids die a year. Globally, it's about 1 million kids a year that die as a result of an injury that could have been prevented.
Underserved communities, urban communities in New York, New Jersey, Connecticut, Pennsylvania, everywhere we're seeing. Worse?
Absolutely.
Why?
Absolutely. Well, it's the where they live. Higher density in traffic, lower socioeconomic housing, a lot of dangers that they have presented to them that others may not. They don't have the resources to prevent the incidents like bike helmets or car seats in many cases, and they don't have the information.
Is it harder to help get the information out in underserved communities?
Well, it can be. Once they know about it, it's a great find. I mean, if they go on safekids.org, there is a ton of free information.
Our producer's always 3 steps. There it is. I know. Safekids.org is up right now.
There's a ton of information.
What's there? They go on the site. What do they find?
Tip sheets, videos that show you, kind of like a YouTube thing, where they show you exactly how to wear a bike helmet, exactly how to use a car seat, where to go to get a car seat if you need one, those types of things. But there's a wealth of information from birth till about 19 years of age.
Safe Kids in this consortium, funded by the government. Where's your money come from?
Well, we are supported by Johnson & Johnson. They are our founding sponsor for Safe Kids worldwide as well, and Central Jersey Family Health Consortium. So we have grants that help provide our resources to do our program.
Let me also clarify that J&J is a supporter of what we do as well.
Absolutely.
Real quick, legalizing marijuana. In the context of our children, which it would be illegal.
Yeah.
So why should that be an issue in terms of protecting our kids?
Well, the aspect that we come to for marijuana for children is basically proper storage, of edibles for children so that they can have access to it, proper labeling, making sure children do not have access if there is marijuana in the home in any format. Oh, we're very concerned about it. It's the same thing with medicines and poisonings, making sure children don't have access to that to begin with.
Define that, making sure, what are you talking about, locking up the medicine cabinet?
Out of reach of children, making sure if we do provide lock boxes for medications so kids can't get into it. The other thing, too, is proper storage. You may have mouthwash that looks like, or a windshield wiper fluid that looks like mouthwash. A child could drink either one of them. It looks the same. So you have to make sure your medications and your cleaning fluids are properly stored and labeled.
Sorry for interrupting, Carol Ann. Our children are older than that infant stage, but I remember all the gates. I remember all those things we did. How valuable?
Well, I'll give you an example. We did a special program where we went into homes and actually provided the resources to these families. And after a period of time, we went back to check to see if that home was any safer. That home was 55% safer than from when we first went in. Because they were, number one, provided with the knowledge. Number two, provided with the resources like safety gates, like outlet covers, simple things.
Where you're plugging it?
Yeah.
To put the outlet cover, that makes a difference.
So it was just simple, tangible solutions. Moving a throw rug so it's not a fall hazard. And as a result, those homes were safer, just from simple knowledge that they received.
Bottom line, we cannot keep our kids safe in every case, but there's a lot more that we could and should be doing, and also not just what we say. As I said, what we do matters. Carol Ann Giardelli, who is the director of Safe Kids New Jersey's Central Jersey Family Health Consortium. I want to thank you for joining us.
Thank you very much.
Very helpful.
Thank you.
I'm Steve Adubato. This is Think Tank. We'll be right back.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 30 years of broadcast excellence. Funding for this edition of Think Tank with Steve Adubato has been provided by PSE&G, Johnson & Johnson, NJM Insurance Group, NJIT, RWJ Barnabas Health, the Turrell Fund, supporting Right from the Start NJ, and by the Robert Wood Johnson Foundation. Promotional support provided by Commerce Magazine and by ROINJ. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.